Hi, I'm Amy with Eastside Wellness Chiropractic. The next step in our active care series is to learn how to use the foam roller for our lower extremity. Just as easily as trigger points can affect the upper extremity, neck, shoulders, serratus, and lats, trigger points can also affect the lower extremities such as your glute, your IT band, your quads, and your hamstrings. When we're doing our foam roller for the lower extremity, what we're going to do is we're going to sit on it just like we're sitting on a chair. Justin is then going to select one hand to reach behind him, and that's going to indicate which direction he's going to shift towards, or what hip he's going to put his weight through. While he's doing this, he's going to shift his weight towards that direction, and he's going to roll through the glute. So he wants to make sure he hits the side of the glute, the back side of the glute, really all angles of that glute. So he's going to roll. He's going to be paying special attention for any kind of tender spots, anything that elicits a little pain, sort of like a bruise that you would push on. As he's rolling through, if he finds one of those tender spots, he's going to stop and spend a little bit of time on it. Now, everyone's a little bit different. To work on these areas, you can do small rocks, where he's just slightly moving, staying in that same general spot. He can hold still and rotate his foot, changing the angle that the muscle's sitting at, whichever seems to work best for him. From the glute, he's now going to come down to his elbow, and he's going to bring this leg, the bent knee, over top of his other leg. What that's going to do is that's going to spin him onto his side. We're now going to move into the hip flexor. The hip flexor is that crease between your torso and your leg. He's going to fall into that hip flexor, and it's just a very small spot. You're going to feel yourself sort of fall into a groove. Now, the hip flexor kind of runs through the front of the hip. When doing this, he's going to either roll more towards his stomach or back a little. He wants to find those areas, just like with the glute, that are a little bit tender. So once he finds it, he's going to feel kind of like a cord-like structure underneath that foam roller, and he's going to stay in that area, either doing small rocks, holding it, and moving, whatever seems to work best for him. From the hip flexor, we're going to move to the IT band. Now, as we're moving from the hip flexor to the IT band, we need to roll over the greater trochanter. That's that bony projection that sticks out from your hip. He wants to roll right over top of it. He does not want to roll on it because that greater trochanter is very superficial. It can cause some aggravation of the bursa sac that lies just on top of it. He's going to roll directly past it. He's going to feel himself kind of rise up a little bit, and then he's going to fall back into the squishy, more muscly part of his leg. Now, the IT band runs from your ilium to your tibia. It runs the entire length of the side of your leg. So he's going to break that up segmentally, rolling each segment until he gets just before the knee. So he's going to roll, and as he progresses down the leg, you're going to see him kind of shimmy and move up the mat using his elbow, using his opposite foot. He can even use this toe to help rock him a little bit. So as he progresses down, he's going to get the entire expanse of the IT band. Now he's going to shift onto his quad. The quad is the front leg muscle. Best way to do this is to roll flat and then move the foam roller so that it is just at the end. Okay, so if he lifts his foot here, you can see he's on the very end of the foam roller. By doing this, this allows his knee to come down so that he can use his knee to help drive him up and down the quad muscle. Again, looking for any of those tender spots. If you don't find a tender spot or something that bothers you, you just keep moving. Really, this is kind of a search mission. We're looking for something to hurt. If we don't find anything, we just keep moving. Finally, the last part, Justin's going to come up onto his knees, and he's going to turn the foam roller so that it's vertical. Let's go ahead and do this leg. He's going to set the foam roller between him, come down onto his forearms, bring this leg up into a figure 4 position. You can see how he's in a figure 4 position, and he's going to roll along the inside of the leg, really paying special attention to that VMO, or vastus medialis obliquus, right where that quad comes in and inserts onto the inside of his knee. While he's doing this, he has an option. He can leave his foot as it is, or he can turn it up or down. Now you can see how this foam roller is kind of getting in Justin's way at the upper body. If we slide this down and angle it out slightly, it can allow him to come down to his forearms if he wants and make it just a little bit easier. Now he doesn't have this getting in the way. It's easier to move and shift through the upper body while rolling the adductors, or the inside of the leg. And that's how we're going to foam roll the upper extremity. We've got the glutes, the IT band, the quads, and the adductors.